I was noticing that there were certain areas that I just really needed to focus on, that I just could not lose and get to an appropriate level of satisfaction with my body. And the first thing I thought about was liposuction.
Liposuction is one of the most popular cosmetic procedures done in this country. It's consistently been in the top 3 for as long as I can remember. And the good thing with liposuction now is there's a trend toward doing this procedure under local anesthesia. That means the patient, we give the patient some oral medication. It's essentially like drinking, a couple of glasses of wine so they're relaxed. And then we numb the area with a numbing solution, which is the same solution that the dentists use to numb your teeth. And once the area is numb, we can actually go on and perform the liposuction.
It was my first time being on local anesthesia with any surgery. And as far as the experience goes, it was a good experience. The pain was at a minimum. It was bearable. And the results were surprising.
So who's the perfect candidate for liposuction? Well, ideally, a patient is very close or at their ideal weight, and they just have some areas of fat that genetically they just cannot get rid of. Realistically though, most Americans are slightly overweight, so most of our patients do not fall into the ideal category, but that's okay. We just need to take on more fat, and if the patient has good skin tone or even a little bit borderline skin tone, as long as they have realistic expectations, the satisfaction rate is actually very high. In my experience, liposuction is actually one of the most enjoyable procedures for me and the patient, because I get to interact with my patients socially for a couple of hours, and I learn about, my patients have interesting jobs, they have interesting backgrounds.
We did have a chance to interact with one another during the procedure, during local anesthesia. You can say, listen, that's a nice song. And, I think that's technology. I don't think we were able to do that before. And if you haven't had a chance to do it, I think you should get up on it and try it out.